If your friends dare you to jump over the bonfire or whatever you think is cool and funny at midnight after you've thrown a few back, don't do it. You just got burned. There are many types of emotional burns, like roasting your friend at his retirement party, or say embarrassing your daughter in front of her prom date. But in the medical world, we're talking about real deal burns today. What do you do? What do you put on them? And how do I know if it's serious? We're gonna go over all your immediate burn questions and more. Hey there, I'm Dr. Jordan Wagner. I'm a board certified emergency medicine physician. My mission is to make videos that answer your urgent medical questions and clear up myths about various diseases and illnesses. If you've turned on your TV lately, you've probably seen wildfires raging throughout California. And with fires, as it relates to what I do in my world in the ER, typically comes the topic of burns. Over 1 million people in the US with burns come to the emergency department each year. Burns are no joke. They range from minimal injury all the way to death. Here are 5 major groups or classifications of burns based on their mechanism of injury or how you actually get burned. Thermal burns, contact burns, chemical burns, radiation burns, or electrical burns. Today we're only going to talk about thermal burns. So what is a thermal burn? Anything that gets you hot and bothered, and not in a sexual way. Thermal burns are caused by heat. You can get a thermal burn a couple different ways, but the two main being a scalded burn, which are injuries that are caused by hot liquids, grease, or steam, or a fire burn, aka injuries that occur either by flash or flame burns. Immediately, if you can, get away from whatever is causing or has caused the burn in the first place and get to a safe place. From there, remove any hot substance as quick as possible, be it water, grease, or oil, and remove the clothing that is either obviously on fire or covered with the hot liquid. Do not put on any home remedy, neighbor-made remedy, Pinterest-made, maybe it might work type of questionable remedy on your wound. Do, however, put a cool compress or ice on the burn. This may help soothe the area and numb the pain. Once the burn has happened, unfortunately the damage has already occurred. When do you go to the emergency department for your thermal burns? If you are in severe pain or you think you might have had a 2nd, 3rd, or 4th degree burn, go to the ER. Also, if the burn is anywhere on your head, face, ears, neck, hands, feet, or any large areas of burn, or you experience any shortness of breath or chest pain, or any of your burns that go completely around, come to the emergency department. Who are at high risk for thermal burn injuries? People of all ages are susceptible to minor burns, but the highest incidence of burns occurs during the first few years of life and in persons aged 20 to 29 years old, with 67% of serious burn injuries occurring mostly in males. So, doctor's advice: if your friends dare you to jump over the bonfire or whatever you think is cool and funny at midnight after you've thrown a few back, don't do it. In all seriousness, if you or someone you know has been physically burned, the quicker and the better you respond to a burn accident greatly reduces the magnitude of the injury. Can you die from a thermal burn? Yes, you can. Burned patients' survival rate is also related to age, presence of inhalation injuries, other injuries, and burn depth. What is burn depth? The depth of the burn injury is classified according to degrees, or the differences between 1st, 2nd, 3rd, or even 4th degree burns. In 1st degree burns, minor superficial damage of the top layer of the skin occurs. Redness, tenderness, and pain are the hallmarks of this type of injury. Blistering does not normally occur. Most common causes of 1st degree burns are flash burns or sunburns. What is a treatment for a 1st degree burn? Number 1, cool the burn down. Immediately immerse the burn in cool tap water and apply cool or wet compresses. 2nd, apply petroleum jelly 2 or 3 times a day, and do not apply ointments, paste, or butter to the burns, as these may cause an infection. Do not apply topical antibiotics. Number 3, cover the burn with a non-stick sterile bandage. If blisters form, let them heal on their own while keeping the area covered. Do not pop the blisters. Number 4, considering taking over-the-counter pain medication such as acetaminophen or ibuprofen, which can help relieve pain and reduce inflammation. And number 5, protect the area from the sun will help minimize scarring, as the redness from a burn sometimes persists for weeks, especially in those with dark skin tones. Typically, a 1st degree burn takes about a week to heal. 2nd degree burns. 2nd degree burns have 2 types: superficial 2nd versus deep 2nd degree burns. Both burns will hurt and blister. What is the treatment for a second-degree burn? Second-degree burns, well, let's repeat the same steps that we had for the first-degree burns. But in addition, if blisters do come off or you have exposed areas of skin, those areas need to have a topical over-the-counter antibiotic applied to that area. Also, keep this burn area covered and do not let it dry out. If the wound dries out, it won't heal well. Second-degree burns typically will take 3 to 6 weeks to heal. If you do require a skin graft for your deep second-degree burn, this will take a lot longer to heal. Third-degree burns. Third-degree burns are what we call full-thickness burns that go all the way through all the layers of your skin and singe and burn all the blood supply and nerve endings to the skin, which results in it typically not hurting as bad, which is not good. The burned skin of a third-degree burn has a white, leathery appearance. Skin grafting is always necessary to resurface the affected area. Emergent scalds, flame burns, chemical burns, and high-voltage electrical burns typically cause third-degree burns. What is the treatment for a third-degree burn? If you think you've had a third-degree burn, get to the hospital immediately and remove anything that still might be burning. Third-degree burns will need a skin graft. Skin grafts are either partial thickness or full thickness, depending on what the surgeon thinks is necessary. Donor skin is usually from your own thigh, buttocks, back, upper arms, forearms, or even abdominal wall. And this type of injury can take weeks to years to heal with ongoing care. Lastly, fourth-degree burns. The most serious and very bad cases of all burns. Fourth-degree burns cause full-thickness destruction of the skin and the subcutaneous tissue with the involvement of the underlying fascia, muscles, bones, and other structures. Other things to consider. We are talking about burn case injuries specifically. But in cases where I see patients from structural fires or wildfires, many will show up with only moderate burns, less than 40% of their total body surface area, but will actually die of asphyxiation or carbon monoxide poisoning before they even reach the hospital. This smoke inhalation can cause both lung damage, other toxic poisonings, which may have life-threatening consequences. All right, I hope I've cleared up some questions you may have had surrounding what to do if you get burned. Make sure you leave me a comment on what other medical topics you'd like me to break down, and if you want me to discuss further the complications of carbon monoxide poisoning or even cyanide poisoning that can occur from house fires, let me know. Also, make sure you subscribe and turn your bell notifications on. That way you will be informed when my latest video goes live. Thank you so much for watching. Stay healthy, my friends.